So in terms of the barriers to accessing screening services, we know from a lot of the research we've done that LGBTQ plus communities face a lot of barriers when accessing primary care and secondary care. So that's either based off a negative experience previously or not necessarily at the same service provider. So you may have had a negative experience in the GP practice and it means that you're delaying access to further screenings. So we believe that there are opportunities to actually provide screenings within community settings. So for example, one thing that LGBT Foundation would love to provide is things like heart pressure monitoring, weight monitoring, things like that. Simple diagnostics that we could provide where people feel comfortable. It's an environment or setting that's familiar, and it means that we're able to capture communities of identity and patients who have previously been hesitant to access services in the past.
The health service is facing some big challenges, and getting people in early for early interventions is better than having people put it off because they don't go and see somebody.
I was referred from Pride in Aging, a group run by the LGBT Foundation, to represent LGBT people on the NHS sounding board. And it's a wonderful way in which the NHS tries to gather information from all its stakeholders to make sure the service meets their needs. So I contribute to that, and we have various meetings talking about innovation, talking about new stuff coming down the line, new treatments, new attitudes. There's a lot going on.
Going back to 2016, when I lost my husband actually, and I went to a bereavement counselling round the table session with, I was the only male, all the others were female, and we started off the session by being asked to introduce ourselves and going around the table. I was asked to start off first, so I stood up and I had to say, my name is David. And they said, the person who was leading it said, would you like to tell us about your wife, David? And I had to say I felt really embarrassed because it wasn't my wife, it was my husband actually. So in effect, I was coming out to all the other people around the table, all these other people, they were complete strangers and I didn't know any of them before.
I was in hospital about 3 years ago, and when I came out and came home, there was a new junior doctor at my surgery that came out to see me, and he had a lanyard on, a rainbow lanyard, and it just made me feel so at ease that I knew that he either was gay or that he accepted, gay people, and I was just so open with him after that.
And all my experience, with all my multiple consultants, it's always been on a level playing field. They never talk down to me. They listen to what I have to say, which is the most important aspect of the whole thing. They actually take time to listen. Now, whether it's because I'm very much proactive with my own health issues and concerns, and I'm very positive about the whole thing, I'm treated differently. I would like to think not.
The discussion with all sorts of different care holders just reveals the tremendous diversity in the number of people that the NHS has to act with. And I've always assumed that by now NHS staff would be trained to understand that you can't actually assume anybody's sexuality. And you have to take that into account. I noticed that more and more GP practices are following guidance from the Pride in Practice scheme that the LGBT Foundation runs. And that's a wonderful thing. If you go to a GP surgery and you see the Pride flag or one of the other flags, posters that we produce, I think that's tremendous. It makes you feel more able to talk openly and you could be assured of some respect as for who you are.
I think that from the point of view of organisations like the NHS, the way forward is to think, if we produce a service and deliver a service that is really genuinely open and welcoming to everybody, nobody loses by that.
The one message that I would say to any ally out there who wants to support LGBTQ plus people is one of the most profound acts that you could do is just to answer that sexual orientation question. Even if you're not a member of the community, it adds to that body of evidence, and it can have such profound effects over the long run.